Hi, today I would like to talk about coronary angioplasty. Well, coronary angioplasty is one of the commonest procedures or treatments that is available for patients with coronary heart disease. Well, this is one of the commonest procedures that I as a cardiologist perform in my daily practice. During the angioplasty procedure, which is done under fluoroscopy, a wire is passed across the stenotic lesion, i.e. across the blockage. Through that wire, a balloon catheter is passed and placed across the lesion and then inflated at high pressures. The inflator, which is positioned outside the body, is inflated at up to 8 to 12 atmospheres to crack open the stenosis. Once the balloon has cracked open the blockage, the balloon is then removed, just leaving the wire in place. Sometimes multiple inflations are required to open up the blockage, and sometimes you may even require several balloons to crack open the narrowing. Once that is done, blood is restored to the coronary arteries. This entire process is called a balloon angioplasty procedure. The procedure itself, as I said, is simple and is done under local anesthesia. Patient is wide awake and is often completed within 15 to 20 minutes. However, not all lesions are straightforward, and certainly some cases which may require multiple balloons and devices to open up the blockages may take longer time, half an hour to even an hour in complex cases. After successful balloon angioplasty, many times a stent or a metallic mesh is inserted as a scaffolding to prevent re-narrowing. Today, coronary angioplasty has become a very popular treatment option for patients with coronary heart disease. The reasons for this are obvious. Many patients find instant relief of their symptom immediately after the procedure, so it's a very effective form of treatment and it can be carried out fairly quickly, virtually painless, apart from a minor scratch for the administration of the local anesthesia. Nonetheless, it's not a procedure that's to be taken lightly, as it is an invasive procedure and it has risks attached to it. The risks attached are mainly minor, mostly bruising around the puncture wound or bleeding from the groin or from the puncture site. Occasionally, you may get reaction to the contrast used or radiation exposure. Major complications such as heart attack or strokes can occur, but the risk of these major complications are very low, less than 0.5%. So less than 1 in 1,000 of these patients will suffer major complications. So on the whole, it is a relatively safe procedure, but not without any risk. So hence, before proceeding with invasive angioplasty procedure, I always advise all my patients to discuss the pros and cons with their cardiologist to see whether the angioplasty procedure is appropriate.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.